friends, Bethany Davis, licensed massage therapist here to show you a few little tricks of the trade on how to massage your partner's lower back. So basically, I don't expect a lot of you to have a massage table at home. If you do have one, that's great, you can use that, but I'm going to do this demonstration just having my partner here on the floor, lying face down. Now, in case your partner has a herniated disc that's leading to some of this back pain, we're going to put a pillow underneath their abdomen just to protect their spine. You're not going to know probably if your partner has a herniated disc, so just go ahead and use a pillow. Have them lift up their abdomen and just slide it under their stomach. This is just bracing their spine now so it's a little bit more straight. Now you're basically going to be working from the bottom of the ribs down to the top of the hip bone, which lies right through here. You'll be able to feel as you push along the top of the hip bone. We're also going to work into the glutes a little bit, as there are a lot of issues that can deal with the hips that actually affect the low back. So we want to work both to help relieve our partner's low back pain. So to start with, we're going to be using our hands. Please do not walk on your partner. The 12th rib is called a floating rib, and if you step on that, you can actually break it. Actually, if you step on any of the ribs, you can break them. But the 12th rib covers the kidney, so if you break that, you can actually damage the kidney underneath. So please, again, do not walk on your partner. We're just going to use our hands. So you're going to use some lotion, or you can use olive oil or coconut oil, any oil that you might have in the kitchen. You just want a little bit. You don't want a ton because you don't want to be sliding all over the place, but you want enough to get a nice glide over the skin. We're starting with some really light pressure to just warm up the skin. We're not going in full throttle yet because that can actually hurt the muscle underneath. You need to warm up the tissue first with some nice gentle glides across the skin. So again, just rubbing the lotion over the skin or the oil, whatever you're using, just warming up the tissue. You should actually feel the tissue start to get a little bit warmer under your hands. And you can start to work into the muscle. So the muscle is kind of square shaped between the bottom of the ribs and the top of the hip bone. So you can go in, kind of like you're kneading bread, and just start to give it some squeezes. Just warming up the tissue. You can push down a little bit towards the hips to give the muscle a little bit of a stretch out. Just warming up deeper into the tissue than what we were doing when we were spreading the lotion over the skin. You can do some deeper fingertip glides next to the spine, not on the spine, next to the spine, going down until you feel a stopping point of the hip. And you can pull that out along the hip bone. So down and along the hip bone. This is working where a lot of the muscles attach into the bones. Just giving them a nice stretch out. You can start to move a little bit further out. Same, giving some nice good pressure, pressing down, and work out towards the lateral side of the torso. You can use your thumb to do these glides. Now, I'm not really pushing myself along. I am applying pressure and using the lotion to let me glide along. So you're using nice slow strokes when you're doing this. The faster you go, the more likely it is to hurt. It's kind of like if you were to take a book and place it on someone versus if you were to throw a book at someone. One's going to hurt more than the other. Speed does matter. And doing some more kneading into the side. So now you can take your fingertips and push them up against the spine, not on top of the spine, and let your fingers drop out towards the side. You're gonna feel your fingers go over almost a little ledge. That's the muscle. So it's gonna come out and then it's gonna drop down. Then you wanna use your fingertips to push in towards the spine. This is gonna help release some of those muscles deep in the lower back. And you're gonna hold this pressure here for a little while, for about a minute. You can use some little circular motions with your fingertips while you're in here. Just loosening up those muscle fibers. You can communicate with your partner. You can ask them if it's tender in there. And as you're pressing in there, it should start to lessen in its tenderness. So when they inform you that it's starting to grow less in the tenderness, you can start to release and back off in there. And just do some kneading, some glides. Go back to some of those moves you were doing at the beginning to kind of finish off that area. Now we're going to start to work into the hips a little bit. I'm going to scoot these down just a little bit so that I get to the top of the hip bone. Again, you can find the hip bone by pressing in. And you want to be about maybe 3 inches at the top of the hip bone showing. We're going to spread some lotion over that area, warm up that tissue. Now right in through here is a large triangular kind of shaped bone. That's your sacrum. So you can do some very gentle rubbing back and forth over that, not using a ton of pressure. Just loosening up some of the muscle attachments that are right there. This can be a very sore spot on people. So rubbing here can feel really, really nice. Again, warm up the tissue. Try to get it so that it feels warmer to the touch. Not using a ton of pressure. All right, so now that I have the tissue pretty warmed up, again, you're gonna find that sacrum, and you're also going to find the head of the femur. So it feels like almost like a doorknob right in through here. So we're going to be working the muscles that are in between those. When those get tight, they can trap the nerve that runs right down the leg. This is often one of the causes of sciatic pain. So finding your sacrum, find the edge of the bone. So glide along the sacrum until your fingers drop down. This is where we're going to start to apply some pressure, some deeper pressure. Let your fingers glide in a diagonal motion towards that femur. Moving nice and slow. You can come in from different directions if you need to. Then you can move along the edge of the hip bone, going down towards the femur. Just stretching out all those muscle attachments in there. You can also knead along the edge of the hip bone. Just like you're kneading bread, trying to pick up the skin a little bit. Try not to be really pinchy when you do it. You want to use a very delicate grip. Another thing you can do, using your fists, you can apply one fist to the top of the glute, one to the bottom, and just kind of knead it, again, kneading like you're kneading bread. You're kind of lifting the muscle up as you're doing this. You lift it up a little bit and release. Lift it up a little bit and release. So the next thing and the last move we're going to do is we're going to, again, find that sacrum bone. We're going to come off to the side of it a little bit lower than where we were working at the beginning. We were working towards the top. Now we're going to work pretty much in the center of the glute. So finding where the sacrum comes off, we're going to apply some pressure between the sacrum and that hip bone. Do this gently. Do not go in with full force pressure. There is a very large nerve that runs under there, and this is going to be a little bit uncomfortable for your partner, but this is a very, very helpful move to loosen up these muscles. So going in gently. I'm not applying pressure yet. My hand is just in position. Go in very slowly, all right? So it should take about to the count of 3 to reach your full pressure. Then you're going to grab their ankle, bend their leg, and you're going to rock their leg, applying steady pressure into the glute, back and forth. Again, this is going to be a little bit uncomfortable for your partner, but this is a very, very helpful move. If it is causing them extreme pain, stop what you're doing. This loosens up a muscle called the piriformis. The piriformis sits directly over the sciatic nerve. And you're just going to do it a few times, between 5 and 10 times. And release the leg down. You can finish off again with some of those kneading movements just to give some pressure and kind of plump up the muscle again after you just squashed it. And then you can finish off with just some nice glides over the back again. Hopefully at this point, this will have helped to loosen up some of the muscles that are chiefly responsible for low back pain. Thank you all for watching, and we'll see you next time.